Hi everyone, my name is Dr. Jenny Zambriski. I'm an infectious disease veterinary epidemiologist in the College of Veterinary Medicine at Virginia Tech. Today I'm going to talk to you a little bit about what it means to flatten the curve. In the midst of the COVID-19 outbreak, I'm sure you've all heard the term flatten the curve, that flattening the curve is the way to reduce the transmission and spread of this disease. But how does it work? Today we're going to explain it. So, on our agenda, who am I and am I qualified? Should I even be having this conversation with you? I promise I didn't Google how to flatten the curve. The first thing we're going to talk about is essential background information. What is epidemiology and an epidemic curve? Next, what is the epidemiology of COVID-19? We'll go over some examples of how an epidemic curve is impacted by human behavior and why flattening the curve actually works. So my background. For those of you who don't know me, that's me. I am a veterinarian and I have a PhD in infectious disease epidemiology, which technically makes me a doctor, but my students call me Dur, and I like to think that that's a term of endearment. My expertise is in emerging infectious disease and in global pandemics, so what's happening right now with COVID-19 is actually what I've been preparing for many, many years. I've lived all over the world and I've worked on some really bad and nasty diseases like Nipah virus in fruit bats and bird flu in chickens and ducks. When I was working with bats, I was living in Malaysia, and when I was working on bird flu, I was living in Indonesia. I've also worked on tuberculosis in elephants in Nepal and brucellosis in cattle in Nicaragua. I've spent most of my time studying how diseases spread. So what is epidemiology? It's not entomology, which I often get asked. Entomology is the study of bugs, which is gross, so no thank you. Whenever I'm asked what is the meaning of epidemiology, I always tell people to look at the word. Is there a word inside of the word epidemiology that stands out to you and looks familiar? I look at the word epidemiology and I see the word epidemic. Epidemiology is the study of epidemics. As an epidemiologist, I study epidemics, but more specifically, I study how diseases spread through populations. Diseases are really fascinating, and they have evolved a lot of different ways to do their job. Sometimes they spread through aerosolization, like coughing and sneezing. Some diseases are sexually transmitted, and then there are my personal favorites, the diseases that have fecal-oral transmission, because if you got that disease, it means you ate poop. Since I'm a veterinary epidemiologist, I like to study diseases that affect populations of people and animals. I just think they're more interesting, but the concepts are all the same. So what is an epidemic? It's the widespread occurrence of an infectious disease in a community at a particular time. And historically, there are ones that I'm sure stand out. The cholera outbreak in London in 1854, when John Snow famously removed the handles from all the water pumps and stopped the epidemic. And then, of course, the Spanish flu in 1917, which, if you're a Downton Abbey fan, we lost some of our best characters. There are different types of epidemic diseases. First of all, there's the re-emerging disease. This is a disease that we already knew existed, but we thought was controlled, and then it comes back. Sadly, the best example of this is measles, due in large part to the anti-vaccination movement. And then there are emerging diseases, which are brand new diseases we've never seen or heard of before. SARS, Nipah virus, and now COVID-19. And then, of course, there are the continually emerging diseases. We know these diseases exist. We expect them to pop up here and there in greater frequency and sometimes on a regular basis. And the best example of this would be Ebola. So what is an epidemic curve? This is a tool that epidemiologists use to visualize how a disease is spreading. It's a type of graph that shows how many new cases of a disease are reported over time. It could be new cases reported each day in a month or each month in a year. So for example, if you look here, across the bottom are the months of the year, and up the side are the number of cases. And this is just for some unknown made-up disease. But let's say that the health department is getting a lot of reports of foodborne salmonella happening in June. And they go back and they look at their data and they look at all the salmonella cases that were reported in February and March and April, and they see that there weren't that many. And then all of a sudden there's this big uptick in June, and then it kind of peters off in July. And they start talking to people and they find out that in May and June a lot of people were visiting a state fair. And then they find out that maybe the regulations on some of the food stands weren't that great. Well, an epidemic curve can help you trace where a disease came from, learn how it's spreading through the population, learn if there are times of year when it could be worse so that you can anticipate it. Epidemic curves are really simple but very useful tools for epidemiologists. So let's talk about the epidemiology of COVID-19 and what we know. We know the transmission route. It's person to person through respiratory droplets, coughing and sneezing. Some individuals might be contagious before their symptoms occur, but right now we have limited information on just how soon before symptoms occur is someone shedding the virus. Based on how the epidemic curve looks so far, we think that this is a shorter period, but we don't really know yet. And what about contaminated surfaces? Epidemiologists love to study things called fomites, which is not actually a bug, even though it sounds like it is. A fomite is an inanimate surface or object. So think about door handles and countertops. Anything that you could maybe wipe a disease on, maybe your nose was runny and you didn't wash your hand and then you touched the door handle and the virus is on the door handle. The door handle is the fomite that could possibly transmit the disease. And epidemiologists love to know whether or not fomite transmission is happening from contaminated surfaces. So far, the epidemiologists at the Centers for Disease Control are saying that transmission from a contaminated surface, or a fomite, has not been documented yet. But I emphasize the word yet because we also haven't really had much time to study it or look for it. The epidemiologists are basing this on how the virus is spreading now and on things like epidemic curves. And the feeling is that the epidemic curve might actually be worse if there was more surface transmissioning happening. We do know that porous surfaces are not likely routes of transmission. And when I say porous surfaces, I mean things like money, paper receipts, fabric, and dogs. As a veterinarian, I often get asked, what if I have a client who's sick and I pet their dog? Am I going to get COVID-19? And the answer is no, that's really, really unlikely. So, how can I get sick? Yes, close contact with someone who is sick with COVID-19 will expose you to the disease, especially if you have more than 15 minutes of contact and you're at a distance of 6 feet or less. And the reason why is that the longer you spend in contact with someone who's sick at a shorter distance, the more opportunity there is for them to transmit the virus to you, maybe by sneezing or coughing. And we say stand 6 feet away because when someone coughs and sneezes, they expectorate. And expectorate is basically the fancy term for they blow germs on you. Well, how far do those germs blow? Well, that's why doctors are saying stay 6 feet away, because that's kind of the splash zone. No, you're not going to get sick from paper documents, money, checks, receipts, or fabric, unless, of course, somebody uses that receipt or that piece of fabric as a Kleenex and then hands it to you. I would definitely suggest not using handkerchiefs during the COVID-19 outbreak. Please just use Kleenex and throw them away immediately and then wash your hands. You also don't need to worry about the clerk handing you a receipt at the store. Again, touching animals and petting dogs is not considered to be a really likely way that you would get COVID-19. I also get asked, well, what if I walk by somebody in the hallway? Well, if you just walk by them, you're not going to get sick. But if you stop, you linger, you have a conversation, you stay in close contact, the longer you stay, the closer you stand, the more likely you are that you could get sick. Or if you just walk by somebody and they happen to turn and sneeze on you in that moment, yes, you have an increased chance of getting sick. The maybe zone, the gray zone, again, is surfaces. The CDC says that surface transmission is a decreased risk, and there's not evidence yet. Things that are porous are not likely to transmit disease. But with that said, I want to remind everybody that there are lots of gross things that live on door handles. Flu and cold viruses live on door handles. So wipe your work area down twice a day with disinfectants. Try to keep things clean. Wash your hands. Don't touch your face. You don't want to contract COVID, but you also don't want to contract any other old dirty virus that might be hanging around. So, how do you stay healthy? This brings me back to the point of the epidemic curve. As you can see here, this curve is tall and steep. How do we flatten it? So I need to give credit here to the Washington Post and to Harry Stevens. This was published on March 14th, and it really is a remarkable explanation of how to flatten the curve. Harry Stevens has taken some very complicated epidemiological principles and has made them very clear and very easy to understand. I cannot recommend these simulations enough. If you have time, please go and visit their website. I'm going to go through the graphics in those simulations now, and we're going to talk a little bit about why flattening the curve works, but also how you actually get the curve to flatten. So, when you look at this curve, what we're seeing is only part of the curve. This graphic is showing the time period from January 22nd to March 13th in the United States and the number of cases of coronavirus that happened over that time period. And as you look, there's nothing, 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 and then right around the first week of March, there's an uptick. And then by the second week of March, it skyrockets. Epidemiologists like to talk about the slope of the curve, and the slope basically just means how steep is it. And as you can tell, this is really steep. It's so steep, it's almost a straight line up and down. Why this is concerning to epidemiologists is that how steep this curve is indicating to them that the way in which the virus is transmitting is exponential. And that's different from something that is, say, additive. If it's additive, it means you have 2, and then you add 2 more and you have 4, and then you add 2 more and you have 6, and you add 2 more and you have 8. But when it's exponential, it means that the cases are doubling every 3 days. So you start out with 2 cases, 3 days later it doubles and you have 4. 3 days later that doubles and you have 8. 3 days later you have 16. 3 more days you have 32, and then you have 64, and so on and so on. So in the ideal situation, we would hope that maybe March 13th was the peak. And maybe on March 13th, what if we had a vaccine and we were able to distribute that vaccine to everybody in the United States and give them immediate immunity so that nobody else could get the disease. And the disease would stop spreading, the curve would reach its peak, people would have immunity, and the curve would begin to come down the other side, and we would be through the end of the epidemic. But that's not what's happening. And why epidemiologists are concerned and why they're telling you to flatten the curve is because what if the curve actually looks like this? What if the 2,000 cases on March 13th were just at the very bottom of the curve? And what if the peak of the curve is all the way off the screen? That's why you have to flatten the curve, because so many more people could still be at risk, and we don't have a vaccine yet. And so we have to do other things and take other steps and other measures so that the curve looks like this and not like this. So these graphics, again, are from the Washington Post. And what they have done is they have taken a made-up virus that has similar properties to coronavirus, and they have modeled what would happen in a completely naive population. So what is a naive population? A naive population is a group of people, and say in the country of the United States, it's all of us, who have no immunity whatsoever to the disease. We don't have a vaccine, so we don't have immunity from a vaccine. And it's not like some of our childhood diseases, say when you get chicken pox, it gives you immunity and then you don't get chicken pox again in your childhood. We don't have that kind of immunity either, which we call acquired immunity, which you get from having had the disease before. So we have a population whose immune system has never seen this disease and doesn't know what to do with it. And then it's also assuming that within that naive population, there are no preventative measures. It's total anarchy. Everybody is sneezing and they aren't covering their cough. People are out licking door handles. Things are just crazy. And so it means that complete transmission is occurring, that anytime a sick person comes in contact with a healthy person, the healthy person gets sick. And look at how steep that curve is. It's almost a perfect bell. The blue are the healthy, the orange are the sick, the purple are the people who have recovered. And in the normal progression of a disease, there's a gradual increase in people who get sick. As those people who are sick begin to recover and develop immunity, there are fewer people in the population who are able to get sick again, and the virus eventually peters out. So what happens if you look at the second graphic, which is the same naive population, except that we've put in a preventative measure? And the preventative measure is that we're using quarantine. But we're not really good at quarantine, and it's kind of a poor system, and some people are slipping through the cracks. Well, you see a modest reduction in transmission, right? That epidemic curve is a little bit more flat, but it's a lot more long. So we have fewer people who are being impacted, slightly fewer, but it's lasting a little bit longer. Okay. So what happens if you take that same naive population and you practiced modest social distancing? And when I say modest, I mean you try to work from home when you can, but you still go into the office a couple of days a week because it just feels awkward not to be there, and you still really aren't sure if your boss is okay with it. But when you're at the office, you try to keep your distance. You try not to be too sociable. But man, this whole COVID-19 thing is getting really stressful, and at the end of the workday, you decide that you're just going to go out to dinner with some friends and have a beer. So you've been really good all day about socially distancing, but at the end of the day, you messed up a little bit and you went out. Well, if you look at the curve with some modest social distancing, you can get a pretty moderate flattening of the curve, right? You can really impact transmission with just moderate social distancing. But what if you really tried? What if you practiced very extensive social distancing? You worked from home every day you possibly could. You didn't go to the grocery store every other day. You made one trip. And when you went to the grocery store, you went by yourself. You didn't bring all your kids. And even though it's really stressful, instead you just stayed home with a bottle of wine and you didn't go out that night. Well, look at what you can do. It's a pretty significant impact. You can almost completely drive down transmission of disease. This is a flat curve. So let's look at this in a different way. So in this first simulated model, the blue dots are healthy, the orange dots are sick, and the purple dots are recovering. And this is the case where we have a completely naive population and absolutely no preventative measures. Everyone's coughing on each other and no one's washing their hands. So I want you to notice that all these dots are moving around all the time, right? If they were socially distancing, they'd be staying in place. And every time an orange dot touches a blue dot, that blue dot turns orange because they just got infected. And pretty soon you have no more healthy people left. You just have people that have recovered because they've already had the disease. And you see that that peak is pretty steep. Okay, so what if you try to quarantine? And you put in that quarantine and it works really well for a while. You keep all the orange dots isolated, but your quarantine is a little leaky and people break through. And those orange dots, they start having more contact with those blue dots and everybody's still moving around. I mean, you have the quarantine, but people are still moving. Nobody's trying to socially distance themselves. These dots are kind of frantic. They look like ants. Okay. So let's go back to the concept of modest social distancing. Well, this looks significantly less frantic than the other two graphics. Why? Because some of those dots are staying in place. Some of those dots are socially distancing. They aren't going out into the population. They aren't having contact. They're staying home and they're drinking a glass of wine. And they're driving down the curve. And that's what it actually looks like to stay home and socially distance. And here's why it works. If you socially distance, you slow the rate of transmission because the time between transmission events is prolonged. Let's say I'm really good for 10 straight days, and then on the 10th day, I can't take it anymore, and I go to the gym. Well, I've at least slowed transmission for 10 days. It would have been nice if I just hadn't gone to the gym, though. But when you slow transmission, what happens is not only do you reduce the number of people you're infecting and keep people safe and prevent them from getting sick, but you give the healthcare system time to cope with the influx of cases. And we all know it's not rocket science. The more people who are sick that can receive care, the more likely they are to survive. Mortality decreases. So in veterinary terms, we call this cattening the curve. That steep red curve, that's that jerk cat that lives in your neighborhood, that unneutered male tomcat who's always trying to start some stuff. He's always growling and snarling at your cat through the window. And then that lazy, flat, gray curve, that's your basic house cat. That's the cat that just wants to sit on the couch all day. He wants to socially distance and just be fed. You want to be the fat house cat. So what can you do to flatten the curve? Well, first of all, I say take a page from my dad's book. As I was preparing this presentation for you, he actually sent me this picture because he wanted me to be proud of him, that he is staying home and socially distancing and enjoying a nice glass of Tempranillo while he listens to Brahms. So practice social distancing. Grocery shop once a week and not twice. Don't take your entire family on the Target run. Eat in. Order takeout. Don't travel if you don't have to. But if you do, drive. Don't fly. Be aware of the high-risk areas and try to avoid them. Self-quarantine for 14 days when you return home. Observe good hand-washing practices. 20 seconds with warm water and soap. Wash your hands after the bathroom and before meals, and at as many opportunities as you can in between. Don't touch your face. And above all, don't panic. Look for good information from good sources. Avoid rumors. People are already afraid enough. Thank you. And remember, we're all in this together.